My name's Janet Whitney. I'm director of the Eating Disorder Program at Sovereign Health. I've also been in private practice for 34 years as a licensed marriage and family therapist. Within the program at Sovereign Health, we use the law of attraction. We are just all energy, and whatever we think about is what we create. So you can imagine people with eating disorders, they're thinking about food, they're thinking about their bodies, they're just so focused on that. And if we can start getting them to focus on what are your dreams, what are your goals? Eating disorders are not about food at all. It's the one thing that looks like they can control and feel like they can have this secret relationship with, but it's really about all these feelings of shame and low self-worth, actually even self-hatred. I've heard one patient say instead of that throwing up is disgusting, she'll say, I am disgusting. And they really feel like that. And so we're dealing with this depth of feeling that goes right through their very soul. So we have a great program at Sovereign Health with people that really care about the patients, and we have a dietitian who meets with them and gets an individualized program going for them. We have great clinicians who, many of them have been through eating disorders themselves. I have a daughter who's 22 years old, and when she was a little girl, I was fighting for full custody of her because I knew there were problems going on in her childhood that I couldn't protect her from. Hannah was 10 years old before I could get full legal and physical custody of her. But in that time, she went up to 170 pounds and she was 5 feet tall. She started losing weight, but she started losing weight until the point where at one point she was 79 pounds and we had to wheel her into the treating facility in a wheelchair. She started out with anorexia, then she got really good at bulimia. She is one of the most determined eating disorder people on the planet. And what it did to our family is that my older two children fought so hard to try to help her, to try to contain her, to try to love her. And as me being a therapist, I tried all these different ways to get through to her. The way I learned to use the law of attraction was actually a suggestion by my two older children. They kept saying, Mom, we don't know if Hannah's gonna live or not, but you're going down with her and we need to help you at this point. So it was actually my middle daughter said, here Mom, here's $5,000. You've always wanted to walk the Camino in Spain, here's the money. So leaving my private practice, leaving my kids, leaving my cell phone, I walked across Spain not knowing at times if Hannah was alive or dead. There were days and days that I didn't know if she was okay. So what I had to do was then learn how to be comfortable with the fact I didn't know what was going on. And so when you live in uncertainty, but you keep moving forward, there's something very powerful in that. And one of the best experiences of that is I carried a stone that she painted, and on the front it said daughter, and the other side said of strength. And I carried it in my backpack for the 500 miles because at the end, there's a huge pile of rocks that you can leave your stone from home. But at that point, I didn't know if she was alive or dead, and I didn't know if I wanted to give up the stone. So I spent a long time deciding I could leave the stone and go on. And I got home, and she was really sick by the time I got home. But I had the strength then to get her back into treatment and keep her alive. You know, she's made it to 22. But that journey did teach me that we're so much stronger than we realize, and we're so much more capable of handling hardships than we even realize. And it also made me realize how strong she is and my other two kids.